Got to wake you up a little bit, right? Get them going. Good afternoon. Today is February 26th. It's 12 o'clock. Beautiful, beautiful day that the Lord's made for us. Madam Clerk, will you take the roll? Don't forget to log in as well. I should probably log in. There you go. Madam Clerk.
Mr. Chairman, you have 7 members present. You have a quorum.
Thank you, Madam Clerk. Before we get started on today's agenda, any personal items to mention? I've got two myself of groups that are in the house today. The Tennessee American Academy of Pediatrics are here, so thank you guys for coming in, as well as the Tennessee Chapter for Children's Health Defense are in the house today. So thank you guys for being here and being part of the process. Without any further issues, we've got a full calendar today. So we will start.
Kelly asked me to tell you that's your folder.
No. There you go. We will start with item 1, House Bill 1226. Get a motion and second. Representative Lafferty, you are recognized, sir.
Thank you, Mr. Chairman. Thank you, committee. This bill simply takes reference to the World Health Organization out of Tennessee Code. United States of America is a sovereign country. We do not recognize other powers in governance of what we do, and I see no need to have this still on our books. So with that, I take any questions.
Thank you, Chairman. Do I see any questions? Not seeing any. Madam Clerk, open the vote, please. All those in favor of House Bill 1226, moving on to Health Full, vote aye. All those opposed, vote no. Madam Clerk, take the vote.
Mr. Chairman, 6 ayes and 2 noes.
6 ayes, 2 noes. The ayes have it. House Bill 1226 moves on to Full Health Committee.
Thank you, Chair. Thank you, committee.
This brings us to item number 2, House Bill 1074. Representative Garrett, get a motion. Motion second. Representative Garrett, you're recognized. I believe there's amendment on this one, correct?
There is. Mr. Chairman, thank you. I'm going to move Amendment 4013, which deletes the bill.
Motion second. All those in favor say aye. Those opposed, no. Ayes have it. You are in proper posture.
Thank you, Mr. Chairman. What this bill does is actually remove language from the Tennessee Code and removes a bill that I passed several years ago regarding prior authorization. I think that bill was passed in 2022, and it provided some communication between provider and insurance company to provide the patient with some communication when additional information is requested. And a year later, there was an overhaul of the prior auth laws as it relates to this that made my piece of legislation I passed irrelevant. So I'm deleting it. That's all it does.
Taking laws off. I like that.
Books.
Thank you, sir, for that bill. Any questions? Representative or Chairman Williams, you're recognized.
Thank you, Chairman. Just a quick question. There's been some discussion about prior authorization in your bill, although it being amazing that we're reducing government involvement in healthcare. The question that I had is, there's been a little bit of communication about prior authorizations being done utilizing AI and not actually technology between or communication between doctor and insurance company. Have you heard anything about this and in an effort that those potential prior authorizations could be denied using artificial intelligence?
Chairman, you're recognized.
Thank you, Mr. Chairman. I think that's a very interesting, I have not heard, but I would be very interested to see how that would develop because it's paramount that that communication is accurate and not from the world, so to speak, where AI is. And AI, in my view, is very hard to define. It's still developing what that is. So I'd be very interested to see how that would develop. But this wouldn't apply in this particular piece of legislation. But that would make me, Mr. Chairman, very nervous if that is indeed part of the prior auth situation.
Chairman Williams.
Well, thank you for that. The only reason why I draw it to your attention now is because you are deleting code. We may utilize your bill in order to fix a problem which may exist, and so I look forward to talking to you about it a little bit further as you go.
As do I.
Thank you.
Any further questions? Not seeing any. Madam Clerk, open the vote. All those in favor of House Bill 1074 by Chairman Garrett, vote aye. All those opposed, vote no. Madam Clerk, take the vote.
Mr. Chairman, 9 ayes, 0 noes.
House Bill 1074 has all the ayes they need. I greatly appreciate you, and thank you for that. Moves on to Health Full.
Thank you, Mr. Chairman and committee. Appreciate it.
Moves us right along. Item number 3, House Bill 631 by Chairman Clemens. Motion. And a motion and second. Chairman, you are properly recognized.
Thank you, Mr. Chairman and committee. I appreciate your consideration of House Bill 631. This bill would establish a grant program within the Office of Faith-Based and Community Initiatives for the purpose of supporting and funding nonprofit and faith-based child care programs for children ages 4 and younger. This would require the Office of Faith-Based and Community Initiatives to use a third of the funds that are appropriated to them in any given year for the purpose of establishing this grant program to fund child care. Child care is a serious problem across the state of Tennessee. We have multiple child care deserts, and that's why institutions within child care deserts would be given priority within this bill for the purposes of allocating those grants. Any of these nonprofit or faith-based child care programs must be licensed with the state of Tennessee and DHS as a child care agency, be in good standing with DHS, and operate on an income-based pricing model in which the family is not charged more than 7%, which has been the number determined to be affordable within the state of Tennessee of their household income. So with that, I'm happy to answer any questions. I would love to see us assist the child care issue plaguing the state of Tennessee and make sure that these children in every community are getting into positive environments that are affordable and available in child care deserts. With that, I ask for your approval.
Thank you, Chairman. I believe we have some questions. Representative McKenzie, you're recognized.
Thank you, Mr. Chair, and thank you for bringing this bill. You talked about the number 7% is a goal. What's typical in the state of Tennessee in terms of the percentage of income that goes toward child care? Do you know what those numbers look like?
Yeah, well, I know the problem that we're facing is child care is so scarce that it's unaffordable. So child care agencies that are duly licensed with the state can charge anything they want, but that 70% has been determined to be what is affordable for household incomes. And in any family that's having to pay over 7%, for one or more children, it has been determined to be unaffordable and create an economic disadvantage to that family. And so, and this is, to follow up on that, these are faith-based and nonprofits, so it's not. The reason that we put it in there like that is because these aren't profit-driven, or these are really about providing positive environments and serving the community. So,
Representative McKenzie.
Thank you. To follow up on that, so yeah, I agree wholeheartedly in terms of it being priced out of a lot of people's economics, and then they end up in a spiral where who's probably not giving them the educational tools as the brain develops at that early age to prepare them for kindergarten, pre-K. That's just it's self-perpetuating problem. Could you kind of further describe what a desert, the term child care desert, and what the problems in those particular areas? Are they urban? Are they rural? What does a typical child care desert look like in the state of Tennessee?
yeah, that's a great question. And so child care deserts aren't limited to any one part of the state of Tennessee. And as the term is defined, which is the commonly accepted use of the term, it means a census tract where there are more than 50 children younger than 5 years of age, and that tract either does not contain a licensed child care agency or has a ratio of at least 3 children in such age group per licensed child care agency slot. So it's really targeting those areas based on the population within that age group and the availability of childcare. And as you know, the availability of childcare is so crucial for, people like myself. I was fortunate to live on a farm with my grandparents, so I could walk across the field, and if my parents, who both worked 2 jobs, out of town, I could stay with my grandparents. But as we know, not every child has that. Not every child has 2 parents. And we kind of grew up in the, we would just go in the house at any age and stay by ourselves sometimes, but that's not necessarily good or available these days. And children are living up in different circumstances. And so they need to be in a positive environment. They need to be somewhere they're supervised. They need to be somewhere where they're being tutored or perhaps or educated in some manner at that early age. So that's what this is targeting, and making sure that there are available slots, because childcare is a serious problem impacting working families across the state of Tennessee. And anything that we can do, whether it's being done in parts of the state of Tennessee within one department or another, I don't think us ensuring that the money we appropriate to this office that was established by the governor, I don't think that, requiring it to spend 1/3 of its funds for this purpose and help us address this serious need facing working families is inappropriate in this circumstance.
Thank you, Representative. Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. Sponsor, so this organization that you're wanting to take 1/3 of their budget, how much are they currently budgeted? Do you know?
I don't know what the proposed budget is this year. I just don't know how they spend it currently. We've requested information of how this agency spends their money, and we don't exactly know that. They won't be audited and haven't provided us those information. So I can't tell you how they're spending money and the exact amount they've been budgeted this year.
Representative.
So you're telling me you've requested from this agency where they're spending their money, and they've replied to you, no, a state agency using taxpayer dollars?
Well, I'm not exactly saying that. I'm because they haven't replied.
Oh,
So that's the only part you got wrong. But to that end, I know we're giving them money, and I know that they are receiving a budget. This governor formed this office, and they are a faith-based and nonprofit. It's the Office of Faith-Based and Community Initiatives, and it's focused on faith-based institutions and nonprofits. And I thought, what better entity to facilitate a grant program to assist these churches? We got churches that want to run childcare, and they just, they may need a little help to do it. And if a church can run a childcare agency and get licensure with the state of Tennessee, why wouldn't we want children in that church getting childcare supervision in a positive environment like that? I think it seems like a no-brainer, but.
Thank you, Chairman. Representative.
yeah, thank you, Mr. Chairman. So if that organization, I'm sure hopefully they're watching your piece of legislation today, so we'll just put out another request for them to respond to your request that the taxpayers would like to know where their dollars are going. So if the governor's faith-based and community initiative program can send you a response in the next 7 days, we would appreciate it. If not, I'll send in a request, and I think this committee, I'd say the rest of my members of the committee would like to know where the taxpayers' dollars are being spent. Thank you, Mr. Chairman.
Thank you, Representative. Chairman Williams, you're recognized.
Thank you, Chairman. Thank you, Chairman, for this bill. I did have curious. Sounds to me like the concern's more about not seeing or getting a return email than it does about daycare. But you and I do share a very distinct point of view as it relates to this department and the funding thereof. You and I both didn't support the funding of it, which is unusual. But the big issue that I have with your bill is currently the administration, DCS, through TASER study between Representative Freeman and I, have gone great lengths over the summer to try to study how we can improve daycare. In fact, Last week, we had a bill in here where we removed the for-profit status from an already existing grant program for daycare because it is a huge problem from Mountain City to Memphis across our state. And so my concern that the focus is more on this department that we share a dislike, I guess would be, for more than anything. And so I won't be supporting your bill today because I feel like that we already have a system in place that we have a grant process in place where we just expanded the utilization of those dollars so that we could get more dollars through DCS to these daycare facilities and those workers through that grant program. And so I appreciate your passion for trying to provide services for parents and families across the state. I just think this might not be the best way to go about it since we already have so many programs that are currently focused on that. Thank you.
Chairman.
Yeah, thank you. And thank you. I appreciate that, and I appreciate your consideration of this. And so the only reason I bring up the not knowing is because I was asked how much this office gets, and I don't know. I don't know how they spend that money. The transparency is an issue, and so that was purely in response to that. So make no mistake, this bill is simply about trying to provide child care in a positive environment in every community across the state of Tennessee. Working families across this state are being just killed with cost of living, and if we can lower cost and make child care more affordable and more accessible to people, then I think any effort that we can make, even if it is somewhat maybe even redundant with another department's efforts, it is worthwhile. And I don't know why we would, not want religious, faith-based, and nonprofits being able to get some grants through this office that, by its own name, seems to have existing relationships with those very entities. We would want our children in those. I know that I attended child care at a church, two churches, growing up before I was at the age of before school age. And those are positive impacts on me. And a lot of those churches across the state of Tennessee are wanting to provide these services and help us address this. And, they're missing a little funding. And so, to the extent that's still a problem, even with existing grant programs, I think we need to do whatever we can to address it. And if we're giving a bunch of money to this one office, the least they could do is give a third of it to this grant program and work with these people with whom they have pre-existing relationships to help us address child care. But I do commend you and my colleague, Bob Freeman, for the work that y'all have done. I've read that study, and it's very well done, and I appreciate y'all's leadership on that.
Chairman.
Thank you, Chairman. Chairman Clemens. I think you're exactly right. We do have a lot of work to do. The interesting part about the bill that was before this body last week was that grant pool that was created for these programs for daycare, it was restricted only to nonprofits, which included churches and those kinds of things. We expanded it because they underutilized the funds that were already set aside so that we could add for-profit folks to that entity. As I said before, we're going to always agree on this particular office probably, but I will say I really feel like that the grant process we currently have and creating a new one would be problematic. And so I appreciate your passion about this, though, and look forward to it. As somebody, much like you, I went to my mom and papa's house, got off the school bus, so that was my daycare. So my parents were working too, and so I completely get it. But in this instance, I'm not going to be supporting your bill today. Thank you.
Thank you. Chairman Leatherwood, you're recognized.
Thank you, Mr. Chairman. I share some of the concerns that Chairman Williams had and was going to bring those up, that this is duplicating the work of other programs, and we did have that program that came through here last week or whenever, expanding it, and I think I was the only no vote on expanding that program from nonprofits to for-profits. And looking at this, I think we are better served by using the funds through the existing program. Your bill would require the creation of 4 new positions. to the tune of $348,000. And I think that $348,000 is better spent if we're going to allocate it into a program where the positions are already filled. So that's $348,000 that's going to create 4 new bureaucratic positions rather than going to help the nonprofits that we're trying to help. So for that reason, it duplicates, and also it says at least 1/3 of the funds for grants. That's good, but that means we're spending up to 2/3 of the money for administration, which already exists in other programs. So we are at quite an expense creating a new bureaucracy to do what a program this committee passed, and I think it's already passed on the House floor as well. So for those reasons, again, I appreciate what you're trying to do, but I think what this committee and body did a week or so ago probably achieves the goal in a much more efficient way. Thank you.
Chairman, you recognize.
Yeah, thank you, Mr. Chairman. I appreciate the concern on that. And the reality is the fiscal note contains assumptions about what would be needed in that respect. It's not an exact figure. And we don't know how many people are necessarily already working over there that could do this job. This is assuming they would have to hire new people, which isn't necessarily factual. And in fact, because of transparency issues, we don't know exactly what they do or how many people are over there. And so I take issue with that $350,000 administrative cost, considering the fact that there are already employees over there who could probably do this job or be replaced by someone who is capable of doing the job. And so I certainly understand your point, and we don't want to waste money, precious dollars, in this environment by any stretch of imagination. But I think I would like to think they're capable of, with the size of the budget I think they have, that they're capable of doing this with no more administrative cost.
Thank you, Chairman. I think we're good now. You're good. Not seeing any further questions, Madam Clerk, open the roll for vote. All those in favor of House Bill 631, vote aye. All those no. All those opposed, vote no. Anybody wish to change their vote? Not seeing any. Madam Clerk, please take the vote.
Mr. Chairman, 2 ayes and 7 noes.
House Bill 631 fails due lack of vote.
Thank you, Mr. Chairman, Committee.
Thank you.
Appreciate y'all.
Item number 4, House Bill 155 by Chairman Hale. Motion and second. Chairman, you are recognized. I believe you have an amendment as well.
I do. Amendment is 3784.
That is correct. Get a motion. Motion and second on the amendment. All in favor say aye. Opposed, no. Ayes have it. You are properly before us, Chairman.
All right. Thank you, Mr. Chairman and committee. Current law permits a registered nurse employed by a hospital, nursing home, or assisted living to pronounce death, provided that the individual is a patient at the facility, the death is anticipated, and the physician has an agreement with the facility to sign the death certificate. This bill seeks to remove the term anticipated from the death pronouncement process for RNs in healthcare facilities. So basically, the amendment rewrites the bill, removes the word anticipated. As we realize and know, the term anticipated is for death is a very relative term. No one knows when that time will come. This bill attempts to streamline the process to be a good caretaker of the deceased individual and respectful for the limited resources we have in our healthcare facilities and communities. I would also say that as some examples to these things happening, you take a lot of rural hospitals. We have a ER doctor that's also covering the floor. If they're working trauma and emergency cases, then we've got someone that passes away on the floor, then they're having to wait for those to get freed up where they're already under doctor care. This would just let them be able, for that RN to be able to pronounce them. Also, for instance, one of the counties that I serve doesn't even have a hospital. So if the death is not anticipated, then they pass away in the nursing home, they have to be taken to neighboring Putnam County to be pronounced. So you're tying up ambulance, you're tying up resources, and then the cost of all of that. So this just makes it where it's just streamlines that and removes that word anticipated. That's all it does.
Absolutely. Thank you, Chairman. I appreciate that. I've had
Thank
the
you.
same conversation in my rural hospitals on some of the issues and the timeline, so thank you for that. Representative McKenzie, you're recognized.
Thank you, Mr. Chair. And, I've been talking with folks about this bill, and I fully understand the driver behind it. I guess one of my concerns is the, the addition of the assisted living and the nursing home facilities. Because, as you say, who knows what anticipated means and can mean, but anticipated can mean that, there's an expectation of this is going to happen in the coming days of, kind of hospice kind of a situation. So that may or may not be, correct, but I do think that word was put in there for a reason, to put some guardrails up and limit potential liability. You get a family that says, no, my loved one shouldn't have died. It wasn't anticipated, and you going in this back and forth. That's why you need the medical profession there, the doctor, not medical profession, but the actual doctor. So that's my concern. I understand the bill, like the bill in terms of a hospitalist, but that's help me to understand why those two facilities, nursing homes and assisted living.
Chairman, you're recognized.
Thank you, Mr. McKenzie. If you stop and think about the population that's in both of those facilities, elderly, I sat at the table with many families and they say someone that's 90, 95-year-old, well, we just weren't expecting this. I mean, at what point do we anticipate that death? So that's why those were included. They're under doctor care. Usually in both of those facilities, they're licensed healthcare facilities. So there's, in any case, if there's a questionable death, then the medical examiner is going to be notified and you're going to handle it under that situation. But with the age of those, in many cases, they're under, as I said, they're already under doctor care. So this just keeps that from having to happen and being transported to a hospital and using those resources to be able to do that. And RNs are already pronouncing, it's just removing that anticipated part.
Thank you.
Any further questions before us? Chairman Williams, you're recognized.
Thank you. Just wanted to thank you for this bill. This is a huge problem, not just in a rural district like yours, even in mine. The example you gave about the ER doc being able to do that, but in complete transparency, we have retired physicians who are contracted just to come in to do this because there's not enough free time in the ER for that ER physician to come down or somebody to come from another department to do that. And so I think what this also does, I think, is really preserve the integrity of the situation as it relates to the families that are involved, because that duration of time, you and I have gotten many calls from people who were waiting on a declaration just so that they could have their loved one's body taken somewhere for their funeral arrangements. And so it's really important for those families to be able to have shorten this time as much as possible, particularly so they can get home and mourn with their family. So I really appreciate this bill. I think your heart is in the right place in it, but more importantly, I think it's going to serve our communities well. Thank you.
Thank you.
Thank you, Chairman. Any further questions? Not seeing any. Madam Clerk, please open the vote. All those in favor of House Bill 155, press aye. All those opposed, no. Madam Clerk, take the vote.
Mr. Chairman, 9 ayes, 0 noes.
The ayes have it. House Bill 155 moves on to Health Full.
Thank you, Committee Chair.
Congratulations. Yes, sir. We're moving right along. House Bill number 5 on the list, House Bill 186 from Chairman Slater. Got a motion and a second. You are recognized, sir.
Thank you, Mr. Chairman. House Bill 186 seeks to address workforce concerns in hospitals. Currently, the law limits the ability of a healthcare facility to hire a surgical technician, first assistant to 3 entities. By adding the American Board of Surgical Assistants, or the ABSA, to the list of approved credentialing bodies, we can expand Tennessee's eligible workforce while maintaining patient safety. ABSA has been in business for more than 30 years and has certified thousands of surgical assistants. This expansion will better serve Tennessee's increasing population and their access to health care services. And with that brief explanation, I stand ready for questions.
Any questions before us? Thank you for that explanation. Yes, Representative McKenzie, you're recognized.
Thank you, Mr. Chair. And my concern with this bill is we have boards and agencies that are vetted, and they can certify any number of, in this case, surgical assistants. I'm trying to understand why we need to add another board. What I'm thinking is we're watering down this thing. We're watering down this process. I think we have 3 right now in the state that the state of Tennessee looks to and says, if you can pass this exam, if you meet this level, then you're authorized to be or certified to be a surgical assistant. Now we're adding a 4th, and you say it's to increase the workforce. I guess why aren't the people going through the other 3? My concern is, and looking at the entity here, and they're doing a lot of business in the Caribbean and other places, and that's kind of their origin, that we're watering down our certification, our students coming out and actually in the operating rooms. Maybe not this one, but I think this is a dangerous road that we're on, where we keep opening up the pipeline and adding more people simply on the thing to say that we need more. Okay, we don't want someone in that surgery room that's not duly authorized to handle any and everything that could happen in there. So that's my concern with opening up this pipeline when we already have several that our graduating students can get certified through.
Chairman.
Thank you, Mr. Chairman, and thank you, because I would share that same concern if I thought that we were watering anything down. Let me give you just a quick background in how I came to this bill. Like most good bills, they come from constituents. I was contacted by a constituent who is new to Tennessee. She had been serving as a surgical assistant in another state. She moved here. She was employed by Vanderbilt Hospital. She contacted me because she and told me that her job was in jeopardy because the test, and this is not really a board that certifies, it's a test that a surgical assistant takes, as I think you implied. She had taken that in the other state. She had been serving as a surgical assistant. So the first thing that I wanted to do was to check even what a surgical assistant did, because that's not my background. I went to one of our members who's a physician, and I asked him, what does a surgical assistant do? How do they get there? He told me that back in the old days that, a doctor could pick anyone who was at the hospital and they could come in and assist and that type of a thing. He kind of gave me a history of it. And so I checked with him as well. And in the meantime, I checked with Vanderbilt and said, is this true? Is this person's job in jeopardy? And they said, yes, because our legislation only allows for 3 tests. It doesn't allow for the ABSA. And Vanderbilt recognized that, yes, the ABSA is a valid test for a surgical assistant. And then we got together with Vanderbilt Health. That's where this bill came from. So I understand your concern. I don't believe we're watering down any of the qualifications. These are qualified individuals to serve in our hospitals.
Representative, you're recognized.
Thank you, and I truly appreciate that explanation, because that is, I would say, valid, and I appreciate you doing the research to answer that question. But I think we need to be careful, because we're kind of the guardians and caretakers of this thing, so we can't get a test that is simplified. So I appreciate you doing your due diligence and finding that out. Thank you, Mr. Chair.
Yes, sir. Thank you. Any further questions before us? Not seeing any. Madam Clerk, open the vote please. All those in favor of House Bill 186, vote aye. All those opposed, vote no. Madam Clerk, take the vote.
Mr. Chairman, 9 ayes, 0 noes.
The ayes have it. House Bill 186 moves on to health full next week.
Thank you, Chairman. Thank you, committee.
Next bill before us will be item number 6, House Bill 1192 by Chairman Subcommittee. Motion and second. No amendment. You are. Oh, yeah, there is an amendment. Nope. No amendment. You are properly before us, sir.
Thank you. Mr. Chairman and committee, this is a study that I'd like to do, and here's the reason why. I've been working with NGOs and my constituents and the Department of Health and THDA and all the departments about continuum of care. The wraparound supports we have for those individuals that are at risk in the state of Tennessee. And over the last year and a half, it's been perfectly clear to me from talking to the state stakeholders and talking to the NGOs at the local level, the way this is functioning is not doing it in a very clear and concise manner. A lot of bureaucracy, a lot of red tape. And so what I'd like to do is before we even move forward with any type of legislation on how to figure out how to fix this and make it flow better between our locals and the state with providing the assets that the state has and the support that the state has for our local NGOs who deal with the people who are at risk. I'd like to do a TASER study on this, to look at this on the continuum of care in Tennessee. Let TASER talk to the departments, let TASER talk to the NGOs, and then let TASER look around the country of other states that are doing this and try to come up with a solution to come back to the General Assembly next year with a recommendation to us on how we can make this whole continuum of care function more efficiently and provide those necessary supports in timely manners and timely ways to the people in Tennessee that are trying to help those that are at the most vulnerable and most at risk. So it's a TASER study, Mr. Chairman and committee. I'd just like your permission to be able to move forward and do this.
Thank you, Chairman. We do have, Chairman Williams, you're recognized.
Thank you, Representative Spicky, for this bill. I do, anytime we get a chance, I serve on TASER. Anytime we get a chance to study things like this, I think it's really good. Just a question. Have you been able to reach out to Director or Dr. Lippard as it relates to whether he can get it done based upon this date? Because sometimes, as a member of TASER, we study a lot of different things, and it's very difficult for them to turn around something in 9 or 10 months. And so, and I recognize as somebody who's sent one to TASER before too, it's very difficult sometimes to meet those deadlines. So I'm going to support your bill today. I think it's a really good idea. I think TASER should definitely study it. But you or I, or together, reach out to Dr. Lippard, make sure he can do it within that timeline. Because what I don't want to do is facilitate a study that doesn't have the appropriate amount of time, and the data and information we get back is limited because of the scope of time. So, thank you.
Chairman.
That is a great recommendation. I'll make that promise to the committee as I'll reach out between now and if it passes to the full committee. And if there's any changes on the date, there'll be an amendment coming in the full committee on a date change.
Thank you. We do have an individual that'd like to speak, so without objection, we'll go out of session. And Miss Bethany Torino? She's not here.
Today.
Never mind. We will go back into session without objection. That might be the fastest ever. There we go. Any further questions on the bill? Not seeing any. Madam Clerk, open the vote. All those in favor of House Bill 1192 vote aye. All those opposed vote no. Madam Clerk, take the vote.
Mr. Chairman, 9 ayes, 0 noes.
The ayes have it. House Bill 1192 moves on to health full.
Thank you, Mr. Chairman. I'll have an explanation for the committee next week.
Thank you, sir. Moving on to House Bill 1157. Representative Lynn. Motion. Got a motion and second. There is an amendment traveling with, correct?
There is. It's actually amendment number 2. Drafting code 4093.
4093, that is correct. We'll get that first on there. Motion and second. All those in favor say aye. Opposed, no. The ayes have it. You are properly before us.
Thank you, Mr. Chairman. This bill is called the Restore Trust in Public Health Messaging Act, and public trust in public health messaging we all know, plummeted during COVID, and people were hearing a lot of very conflicting information. And a lot of times that information even divided families. I think many of us have constituents who have family members who don't even talk to them today over things that were happening during COVID, and that really is a shame. And professionals too, they suffered because of differing opinions. And in 2024, a congressional report on COVID highlighted the necessity for public health agencies to maintain strict adherence to FDA-approved product labeling in their messaging to maintain public trust in health communications. So basically, we can't help what TikTok says or the internet says, but we can make sure that government health agencies stick with what the FDA says is true, and that will greatly help with public messaging. That will greatly help the understanding of the public. This state-level adherence to FDA labeling will help install much-needed checks and balances that is currently missing in the public health system and ensure that no matter what the federal agencies say, our public health messaging is based on FDA-approved labeling, which reflects the current science on the products. And this legislation will also help restore trust in public health messaging by ensuring that our public health agencies, as well as the governor's office, which also distributes public health messaging, stay strictly within the labeling authorization for FDA-regulated vaccines and masks and other emergency use products. The Department of Health has worked with us on this legislation. I understand that they are deferred, but they have told me that they're comfortable with the amendment. And Mr. Chairman, I do have two folks here who would like to briefly.
Yes, thank you, Representative. We will, without objection, go out of session, and we have two individuals to speak in support. If you both don't mind coming, Dr. Denise Sibley and Ms. Bernadette Prager, she's here. What's that? Prayer. Pager. Yeah, no, we're close. If you guys don't mind, speaking your name onto the record, and then you each will have 3 minutes.
Okay, and it sounds like I'm on here. So my name is Bernadette Pager, and I'm here representing myself. For about 10 years, I've been an advocate for fully informed consent and scientific integrity in public health policy. This was a problem prior to COVID, where a lot of us were noticing that the messaging coming out of the CDC pushed through the states was not actually based on product known risks, capabilities, that sort of thing. And so it's been a big mission. During COVID, this was amplified when we saw messaging coming out on brand new MR technology products, for instance, where they did not complete phase 3 trial studies. Those still have not been completed, and yet they were being marketed as safe and effective, and even for 6-month-old babies and pregnant women, even though there were no studies to back that up. And so this caused a lot of distrust. You had people who were trying to really closely follow science, and others who were listening to marketing messages. And it did divide families. It tore families apart. It tore marriages apart. There were people who were left in nursing homes who couldn't have their loved ones visit because they refused to get the shot. And they ended up spiraling into depression and dying alone. And we don't want to ever see this happen again. And as Susan said, the Department of Health understands the goals of this bill, and they looked at the language. We worked on it to narrow the focus here to just the vaccines, masks, and emergency use authorized products. And they understand the goal of what this is and how important it is to restore trust in the messaging coming out of public health. So I hope you will pass this bill today. Thank you.
Thank you, ma'am. And Dr.
Yes. Thank you.
You're recognized.
My name is Dr. Denise Sibley. I'm a private practice internal medicine physician from Johnson City. Been in practice 35 years. Thank you, Chairman and committee, for letting me speak. I've been here before, and I'm a passionate advocate for the health of Tennesseans, as I have been for the last 5 years. My concerns today are I support this bill. and I represent myself. But my concerns result really from a notification that I received, and I might want to enter this into the record if that such thing is allowed. But it was a notification that I received from the Tennessee Department of Health, a Dear Colleague letter, in September of 2024, urging me and my colleagues to recommend concomitant, that means giving it at the same time, administration of 3 vaccines for the fall and winter season. That would be influenza, RSV, and COVID-19. That's more than 10 different types of vaccines, and it's complicated. But missing from the letter was any data on the safety of concomitant administration of these shots, nor did it mention the known safety risk of the individual shots. And I knew that no study existed that examined or much less assured me as the doctor that my patient was safe with co-administration or concomitant administration of these 3 shots. And so my question immediately arose as to why is this lacking data when it's coming from the Department of Health. It didn't talk about any significant adverse events. And just one study that I looked at on the FDA website showed co-administration of the new RSV Arexvy by GlaxoSmithKline and an FDA-approved flu vaccine had shown that 2 patients developed encephalomyelitis, which is a severe inflammation of the brain and spinal cord, and that occurred at 7 and 22 days, and 1 died. They also had Guillain-Barré syndrome, which is a paralyzing syndrome, and atrial fibrillation. So I knew that at least that co-administration study of 2 things was suspect. And if you probe, there are others. So I, as a physician who relies on actual data for treatment and prevention advice to patients, there were no medical literature references or citations, only the opinion of the CDC expressed. And unfortunately, this was parroted by the Tennessee Department of Health. In essence, the Tennessee Department of Health and the CDC was providing a thinly disguised advertisement for the pharmaceutical products and making claims beyond the scope of the FDA authorization or approval. And I just ask that the Tennessee Department of Health should not be an advertising arm of any industry. They should rely on recommendations that are based on scientific citations and not merely statements of
Thank you, Doctor.
opinions.
That's
Thank you,
3.
sir.
Greatly appreciate it. We do have a couple of questions, I believe, for you guys. Representative Mitchell, did you have one?
Yeah, Doctor, you spoke of a couple of instances where those vaccines this year have had adverse effects. Isn't it true that every vaccine that ever created, that when you give 50 million shots, there's going to be a certain percentage of adverse effects? You know, I have a close friend. He had Guillain-Barré syndrome from the flu vaccine a few years ago. You know what? He still gets the flu vaccine, every year because the odds of him having that again over getting the flu and something adverse happening from that is a whole lot greater than the chance of that adverse effect again. Wouldn't you think so?
Well, it's true. Excuse me. Yes, Representative. There are adverse events to every vaccine. What I am advocating for is true informed consent, where you have the risk of the vaccine versus the risk of the disease. And when you're giving it to a healthy person, they want to know. Now, if they're stage 4 cancer and there's some treatment that you might offer that's risky, that's a whole different ballgame than a healthy person, the risk of a cold.
Representative, yes.
So, yes.
Yeah, and you're advocating for proper research to be done before these vaccines. I think probably the necessity of the COVID vaccine and the tens of thousands dying weekly in our country, they did the best they could, but you're advocating on your website for a therapy that there is no research whatsoever showing ivermectin helps anything except deworm horses, and it doesn't help with COVID. So it's hard for me to sit here and and question what medical science has done, especially in saving all the lives during the COVID pandemic, knowing that you are advocating taking, horse dewormer for a cure for COVID, and you can't show me any research for that.
Thank you, Representative. Actually, there's over 100 studies related to ivermectin in the treatment of COVID, and that's maintained on a data website. But that doesn't have anything
Was
to
that
do with
study
this.
conducted by Joe Rogan?
Representative, let's stick on the actual bill, and we'll move. Representative, or Chairman Williams, you have a.
Thank you. I might want to wait. I wanted to discuss with the Representative Lynn when we went back into session.
Any further questions for the witnesses? Without any, we'll move back into session without objection. Representative, you are recognized. Chairman Williams, do you have a question?
Thank you, Representative Lynn, for this. The question I have for you is last year, similarly, the Attorney General of the United States, not Attorney General, the Surgeon General of the United States, generally was the one who was helping issue CDC protocol or recommendations as it relates to the nation's health regarding that. This body passed a bill that said that they would follow Tennessee's Department of Health's commissioner and the guidance that they have based upon a similar concern that this body had regarding those recommendations and the science behind those. My question is to you is if this bill were to pass, based upon the way the amendment reads in my mind, it may impugn our Commissioner of Health to be able to make recommendations. Are you, have you considered that? Are you concerned about that, or as it relates to the language of the bill?
No, not.
No, you're good, Representative. You're recognized.
Thank you, Mr. Secretary. Not really, because what this is saying is that the background information behind those recommendations would be what we do truly know about the product as approved by the FDA for those products. And this is regarding products.
Okay. Thank you very much.
Chairman, you good? Any further questions? Representative McKenzie.
Thank you, Mr. Chair. And as I was listening to this, what the thought that rang through to me is kind of harken back when we were in the throes of the pandemic. Is I'm actually really glad that these couples are arguing about it and these families are arguing because they're here. They're here to argue. They're here to voice opposition, and that's what really makes our country great, that we can take in information, that we're considered extremely bright, and that we can take in and process information in an informed way. So that was a message that I received. I'm glad that they're here. For whatever reason, whatever their beliefs are on COVID, I'm glad that they're here to have those arguments. My question, though, is I'm trying to understand the link between messaging on a drug and messaging on a mask. Why are we putting mask in this in terms of messaging, and what negative messaging? I mean, again, I'm trying to understand the connection between a drug, like it or not, and a mask.
Yeah.
Representative.
Thank you, Mr. Chairman. Well, the masks, believe it or not, they really do not stop viruses. And in fact, when COVID was ongoing, and my husband even went to, and I'm just using my husband anecdotally, I did not write this bill. This was included in the bill when it came to me. But I think this is widely known. When you go to the pharmacy to buy those masks, it says right on the package that it doesn't stop the spread of viruses. Right on the package. I remember my husband buying a package, bringing it home, and said, oh my goodness, what's going on? You could tell it was such a, of course there was so much fear, and it was such a frenzy of information that was being put out there. But if our federal and state government, if they're always a source of truth based on the studies that have been approved by the FDA, hopefully that can quell a lot of the frenzied messaging. You can't stop people from saying what they say on Facebook and Twitter, and I am very sad for all of the family fights that have gone on. In fact, I have cousins who have 6 children, and 4 of them will not speak to the other 2. They just will not because of all of that disagreement. Then I have many constituents who say, my brother still won't talk to me, all of that. And that is unfortunate. And hopefully that will never happen again. We hope that those fences will be mended. I certainly do. I think it's very sad to continue to be angry. But, we as a state, we hope that our messaging will always be of the highest integrity based on those studies.
Thank you, Representative. Any further question? Not seeing. Representative Grant, you are recognized.
Thank you, Mr. Chair. I guess I'm a little bit confused. I'm slow to begin with, but
Sure.
Can you summarize again real quickly what this legislation is actually doing?
This legislation will make sure that the messaging put out by our Department of Health, we can't control the federal government, we can't control any other governments, but the messaging put out by our Department of Health will maintain strict adherence to the FDA-approved product labeling and, not go off in other areas. And that way, when people look to our Department of Health, it will always be that source of truth.
Okay, I've heard ivermectin, I've heard mask, but you didn't mention either one of those just now.
And I'm sorry, excuse me.
Representative, you're recognized.
Can you repeat that? I'm sorry.
I said in the conversation, I've heard ivermectin and mask, but in your summary, you didn't mention either one. So help me close that gap.
Representative.
Thank you. This is about overall messaging. Who knows if we will ever be in a panic situation like we were a few years ago. I hope we will never be in that situation, but it is preventative, so going forward, we know that our state messaging to the public will always be based on those FDA-approved product labeling studies and all of that, rather than the frenzy that we saw all over the place. We will always be a source of truth.
Okay.
Without seeing any other question, Madam Clerk, would you open the vote? All those in favor of House Bill 1157, vote aye. All those opposed, vote no. Madam Clerk, take the roll, or take the vote.
Mr. Chairman, 6 ayes, 2 noes, and 1 present not voting.
Thank you for that. The ayes have it. House Bill 1157 moves on to health full.
Thank you, Mr. Chairman. Thank you.
Moving along to item number 8, HJR 1, motion and second. Chairman Reedy, you are recognized.
Thank you, Mr. Chairman and committee. The House Joint Resolution 1 is an urging resolution, urge Congress to enact legislation to provide for veterans access to treatment for traumatic brain injury and post-traumatic stress disorder that includes hyperbaric oxygen therapy. In supporting document, there is a medical doctor by the name of Greg Murphy out of North Carolina who was a state representative that brought this a few years ago and created funding just for that for the state. But not only did he do that, well, he is now in Congress pushing for a pilot program for our veterans. And in his letter in support, the background studies demonstrate that HBOT is an effective treatment for veterans suffering from PTSD and TBI. Authors of one such study described HBOT as having one of the greatest reduction in PTSD symptoms in a 4-week period with any reported treatment. The Veterans National Traumatic Injury Treatment Act is supported by the Vietnam Veterans of America, AMVETS, and Fleet Reserve Association Military Veterans Advocacy, as well as Treat Now. And so with this urging resolution, we're just urging our delegation in Washington, D.C. to support this pilot program for our veterans and military folks. Thank you, Mr. Chairman.
Thank you, Chairman. Any questions from the committee? We've talked about the research on it is very enlightening and has a lot of positive to it. So I appreciate you bringing this bill for the veteran. Without any question, we'll open the vote. Madam Clerk, all those in favor of House Joint Resolution 1, vote aye. All those opposed, vote no. Madam Clerk, take the vote.
Mr. Chairman, 9 ayes, 0 noes.
The ayes have it. House Joint Resolution 1 moves on to full committee.
Thank you, Chairman.
Thank you, Chairman. Without objection, we're going to go out of order real fast. Have to do that. Item number 10, House Bill 584 by Representative Atchley. Motion and second. Representative, welcome to the Health Subcommittee. I believe it's your first time as well, right? We appreciate you being here.
Thank you, Mr. Chairman. House Bill 584 just simply renews the annual allotment for 125 new Medicare skilled nursing facility beds through June 30th, 2029. Just re-upping the sunset date. That's all this bill does.
All this bill does. Representative, or Chairman Williams, you're recognized.
Yes, I was reading through the tenets of the bill, and I didn't notice. How long have you been a resident of this facility?
I probably maybe should be there, but I've not been there yet.
Okay. Well, I didn't notice that you were on the list, so I guess I'm going to support it today. Thank you for your first bill.
Any further questions or comments? Question has been called. Madam Clerk, open the vote. All those in favor of House Bill 584, vote aye. All those opposed, vote no. Madam Clerk, take the roll. Take the vote. Ma'am.
Mr. Chairman, 9 ayes, 0 noes.
The ayes have it. House Bill 584 moves on to Health Full. Congratulations, sir.
Thank you, Mr. Chairman and committee.
This brings us to our final item, number 9, which would be House Bill 959 by Representative Hemmer. Motion? Second. Oh, man. Comes in handy. Representative, you are properly recognized.
Mr. Chair, I have an amendment, if you would mind, drafting code 4049.
40. Motion second. All those in favor say aye. All opposed? No. The ayes have it. Representative, you are now properly before us.
Thank you, Mr. Chairman and members of the Health Sub. This legislation is brought to me by the Tennessee Association of Marriage and Family Therapists. This legislation modernizes the Tennessee's marriage and family therapy licensing process by updating outdated terminology and procedures. For example, we're updating the term regular to independent license route, and also replacing oral exam with written exam, as the exam has only been offered by the state's internet platform and has not been done orally in many years. So we're also addressing some terms that have been confusing to the public. The bill replaces the term temporary license with associate license and introduces the AMFT designation. So this would bring Tennessee in line with 25 other states that are using associate terminology. This is not changing educational requirements for licensures, just updating those terminologies, and want to thank the Department of Health and Board of Marriage and Family Therapy licensed and professional counselors and pastoral therapists. That's a long name, for working in collaboration with the association on this legislation.
Thank you, Representative. Any questions from the committee? Not seeing any. Chairman Williams, you are recognized.
Does this in any way lower the standard as it relates to training or education as it relates to these individual therapists?
Representative?
Thank you, Mr. Chairman. No, sir. It doesn't do anything with educational requirements.
Thank you.
Any further questions before us? Not seeing any. Madam Clerk, open the roll, please. All those in favor of House Bill 959, vote aye. All those opposed, vote no. Madam Clerk, take the vote.
Thank you, committee.
Mr. Chairman, 8 ayes, 0 noes, and 1 present not voting.
The ayes have it. House Bill 959 moves on to Health Full. Walked away. Any further issues before us? Not seeing any. Without objection, we are adjourned.